Hi, Dr. Kathleen Coates here at Coates Hearing Clinic. Today I want to talk to you about exploring the impact of diabetes on hearing and balance health. November is National Diabetes Awareness Month, so we want to do our part to raise awareness of the link of diabetes and hearing loss, as well as balance disorders and fall risk. The importance of this is not only for prevention, but if there is some type of damage or issue, earlier treatment the better. A little bit about who we are. So we really focus on patient education, community outreach and involvement, which is why we like to put together videos like this together. We also focus on collaboration of care with physicians and specialty physicians as well, especially when we're talking about diabetes, treating the patient as a whole. We have 3 locations: Smithfield, Goldsboro, and Clayton. What is an audiologist? So just a little bit about our field and our degree. It's a doctoral level degree that focuses on learning how to find possible causes of hearing loss and balance disorders, to determine the best research-based treatment, and collaboration with specialty and primary care physicians. So audiologists are the primary healthcare professionals who evaluate, diagnose, treat, and manage hearing loss and balance disorders of all ages. It is a 4-year doctoral degree, so 4 year of undergraduate degree and then a 4-year postgraduate degree. Some quick statistics: approximately 15% of American adults age 18 and over report some trouble hearing. So it is very common to have hearing loss, and there's many different causes. About 5% of adults 45 to 54, but then that increases to 10% 55 to 64, which is why we recommend baseline hearing testing at age 55. 22% of those aged 65 to 74 do experience hearing loss, and that increases again to 55% of those who are 75 and older. This is very common. We definitely want to have the patient tested sooner rather than later. There's so many different causes of hearing loss that can happen over the years, and there's many different health conditions that can contribute to this. Some warning signs to watch for if you or someone you love is experiencing some hearing loss. Oftentimes they're having to ask for repetition, not being able to understand what's being said the first time around. This can cause some frustration in just day-to-day communication with your loved ones. Difficulty hearing in background noise is a very common symptom of hearing loss. Patients notice that in restaurants, group settings, church, places where there's any background noise, they're starting to have some difficulty. We also get this comment a lot that it's not me, everyone mumbles. So it could be, though, that there may be some underlying hearing loss that needs to be addressed. Difficulty hearing women and children's voices. So on average, women and children's voices are higher pitch, maybe a little softer. One of the most common types of hearing loss does include damage to the opening of the inner ear, the cochlea, which affects certain pitches more than others first. So this is common for someone with hearing loss. Their family members or friends are usually the ones that notice it first. Hearing loss can happen so very gradually that the patient themselves may even not notice it more than their loved ones. So it's oftentimes a family member, a friend, a spouse that is strongly encouraging the patient to come in to get tested to see what's going on. And it could be selective hearing. We don't know, but at least when they come in, we'll be able to determine that. Memory issues, cognitive decline. This is a big one. Anyone who's experiencing that needs to have a baseline hearing evaluation. This is in research quite a bit in the last few years of this link, and I'll go over it a little bit more, and we have some other talks on that specifically. Depression, anxiety, social isolation. We don't want the hearing loss to get to that point. If you're starting to notice that, if you're avoiding certain situations or people or places because you're not being able to participate in the conversation, you need to come in and get tested. There are many health conditions linked with hearing loss. Today we're going to focus on diabetes, but heart issues, thyroid disorder, kidney disease, Parkinson's, migraines, TMJ disorder linked with tinnitus or ringing, buzzing, whooshing, any cricket sounds in the ears, cervical spine issues linked with balance conditions, cancer, age, cognitive decline. So for any patient that walks through our doors, we're asking some extensive history, not only to help determine the cause of some issues and some damage, but help us determine the next route for treatment and for prevention. Diabetes and hearing loss. So this is what we're going to focus on today. But the variable pathologies and times of onset associated suggest multifactorial processes, but diabetes remains a definite risk factor for hearing loss in many, many studies. There are a number of other underlying factors with this, some other risk factors of diabetes that patients experience that cause the hearing loss over time, but diabetes is definitely a risk factor. Hearing loss is about twice as common in adults with diabetes compared to those who do not have the disease. So again, the importance of early intervention, early testing to help determine and to monitor the hearing over time. Even people with prediabetes have a 30% higher rate of hearing loss than people with normal blood sugar levels. Over time, high blood sugar levels can damage small blood vessels and nerves in the inner ear. Low blood sugar over time can damage how the nerve signals travel from the inner ear to the brain. Both types of nerve damage can lead to hearing loss. So having that effect, having that connection there, even more important reason why to have an evaluation. When we're talking about balance in diabetes, I wanted to touch briefly on your balance system. Your balance system is 3 systems working together, providing signals to the brain to keep you in balance. Your vision is very important, and you know the link of vision and hearing loss with diabetes. Your joints and muscles, so your somatosensory system, your strength in your muscles, that is a big part of your balance system. When you have 1 or 2 systems that are weaker and they are untreated, that definitely increases your risk of falling. Audiologists specialize in balance assessments. So we are performing specialized tests. We call it your vestibular, your balance system. We check for peripheral or central issues and then refer on from there based on what the findings show. So if somebody has diabetes and hearing loss and balance conditions, this type of testing may be warranted. While the cause of falls is often multifactorial, just like with hearing loss, diabetes has been shown to be a significant factor. So there's so many different possible multifactorial factors in this, including your feet, your joints, your muscles, medication side effects of dizziness, hearing loss linked with balance, which we'll go over here in a minute. So just understanding those links and those factors is important to help reduce your fall risk. Falls are a major concern. We know this. The high prevalence of falls in ambulatory elderly individuals with diabetes is well established, with reported annual incidence rates of 39% in those over 65, 35% over 55. So working really hard as our profession, working with your providers to help reduce risk of falls from a multifactorial, multidisciplinary approach. There's a number of mechanisms that can contribute to falls: decreased sensory motor function, your muscles, neuromuscular deficits, foot and body pain, medication complications, especially offloading footwear, making sure that it's fitting right and it's working well for you. Let's talk about reducing your risk of falling. Weekly balance training sessions, with or without additional strength and or gait training, have been shown to reduce fall risks in patients who experience diabetes. We work very closely and partner with our local physical therapists, strongly recommend an evaluation and a fall risk assessment with any balance concerns or any fall risk history. Design modification for offloading footwear. You want to make sure that it is appropriate fit, that is helping you with your posture stability and reducing your fall risk. Other recommendations include, obviously, checking your eyes and your vision, very important for balance, and also with your inner ear, so testing your hearing. When I showed you the 3 different systems working together for your balance, we want to make sure that we check everything. And of course, control of your blood sugar levels and the diabetes itself. Discussing medication or lifestyle changes with your doctor may include, medication, may include weight loss, may include exercising, may include visits with a dietitian. So there's a number of different ways to help manage and prevent this from getting worse. Diabetes and hearing loss. So if there is an underlying hearing loss, hearing aid treatment has been shown to reduce your risk of falls. So just like getting glasses, if you have vision loss, making sure that each system is working the best possible way that it can to help reduce your fall risk. Studies suggest that consistent use of hearing aids can reduce this risk. We also want to monitor any changes in your hearing over time, making sure you're getting the appropriate amount of sound and stimulation through that hearing pathway. Collaboration. Audiologists are a part of your team. We collaborate with your primary care, with your endocrinologist, physical therapist, otolaryngologist. So you are going to have a team approach most likely to your diabetes care. So it's very important for us when we test your hearing, or if we notice a change in your hearing, to get it tested sooner rather than later, and to help in monitoring and managing your care long term. Thank you for listening. I hope that you learned something today. I hope this encourages you to get an assessment or evaluation. If you are noticing some of these symptoms, if you are noticing some of the warning signs, come in sooner rather than later so we can help along the process.